Imagine standing at the beginning of one of the most powerful and unforgettable experiences of your life. Not confusing explanations, just clear, calm, honest guidance to help you feel ready, confident, and in control. Before we start, if this type of content supports you during your pregnancy journey, make sure you subscribe to the channel and enable notifications so you never miss a new video. What natural birth really means. Natural birth is simply the process where your baby is born through the vagina without major medical interventions. For some women, natural birth is fast and smooth. For others, it's longer and more intense. Every experience is unique, and that's the beauty of it. What matters most is understanding how your body works. During natural birth, your uterus contracts rhythmically. Your cervix slowly opens. Your baby gradually moves down until you finally meet face to face. This video will help you understand that journey from the first signs of labor until those first magical minutes with your baby on your chest. How your body prepares for labor. Long before labor starts, your body begins preparing quietly. Your baby may drop lower into your pelvis. Your joints loosen. Your cervix becomes softer. You might feel more pressure, more heaviness, or more back discomfort. All of these are signs that your body is getting ready. You may not notice them day by day, but they're happening and they're important. Early signs labor is approaching. As the big moment gets closer, you may experience a few clear signals. You might feel mild, irregular contractions. These can come and go without forming a consistent pattern. You may notice an increase in vaginal discharge or the release of the mucus plug. You might feel stronger pelvic pressure or slight cramps, similar to period pain. These are all gentle reminders that your body is transitioning toward actual labor. They don't mean your baby is arriving immediately, but they do mean you're getting closer. The start of true labor contractions. Real labor usually begins when your contractions become regular, stronger, and closer together. You'll feel the difference. Real contractions build gradually, peak, and then fade. They come in waves. In the beginning, you can still walk, talk, breathe normally, and rest. You'll notice each contraction, but you can manage it. As time passes, these waves become more intense and frequent. This is your uterus working, pushing, and guiding your baby downward. When the water breaks. Your water may break early in labor, late in labor, or even during pushing. It might feel like a gush of warm fluid or a steady trickle. Once your water breaks, you'll usually head to the hospital if you aren't already there. This is a major sign that labor is progressing and your baby is on the way. Going to the hospital. When contractions become regular and strong, or when your water breaks, it's time to go to the hospital. Stay calm, breathe, know that everything happening is part of the natural rhythm your body was designed for. At the hospital, a nurse or midwife will check your dilation, monitor the baby's heart rate, and make sure you're progressing normally. The dilation stage. This is the longest stage of labor. Your cervix needs to open from fully closed to around 10 centimeters. In early dilation, you may still talk, move, and rest between contractions. As dilation progresses, contractions become stronger, deeper, and longer. Your breathing becomes more focused and your movements become slower and more intentional. This is where support matters. You might use breathing techniques, gentle movement, warm showers, massage, or simply holding someone's hand. Everything you're experiencing is your body opening, stretching, and preparing for the moment of birth. Transition, the most intense phase. Transition is often the hardest part of natural labor, but also the shortest. Contractions may feel overwhelming. You may sweat, tremble, or feel emotional. This phase means you're almost fully dilated. Your body is shifting from opening to pushing. Many women describe this as the moment they question whether they can continue, yet this is also the moment they're closest to meeting their baby. Your body is powerful. Your mind is stronger than you think. And this moment, even though intense, has a purpose. The pushing stage. Once you're fully dilated, you'll feel a natural urge to push. It often feels like the pressure of needing to use the bathroom. Each push is guided by instinct. Your care provider may coach you through it, helping you direct your strength downward with each contraction. This stage varies in length. Some women push for minutes, others for hours. With every push, your baby moves lower. You may feel stretching, pressure, and burning. This is normal and temporary. When your baby's head begins to show, it's called crowning. The burning sensation means your tissues are stretching to make space for your baby. The birth of the baby. With a final series of pushes, your baby's head and body emerge. This moment is full of power, relief, and emotion. Your baby recognizes your voice, your scent, and your warmth. Breastfeeding may begin naturally, or you may simply rest together. Your body releases hormones that calm you, bond you with your baby, and begin healing your tissues from the inside out. Delivering the placenta. After your baby is born, you'll experience a few mild contractions to deliver the placenta. This stage is usually quick and far less intense. Your healthcare provider will check to make sure your uterus is firm and that bleeding is under control. Your baby remains with you, close to your skin, adjusting to the world while your body completes its final steps. The first moments with your baby. These minutes are some of the most powerful memories you will ever hold. Your baby recognizes your voice, your scent, and your warmth. Breastfeeding may begin naturally, or you may simply rest together. Your body releases hormones that calm you, bond you with your baby, and begin healing your tissues from the inside out. Recovery after natural birth. In the hours and days after birth, you may feel soreness, swelling, or fatigue. Your body will be healing from the inside, and this takes time. Rest is essential. Hydration is important. Support from your partner or family makes a big difference. Many women find that walking gently, eating nourishing foods, and sleeping when the baby sleeps helps tremendously. Natural birth recovery is often faster than recovery from a surgical birth, but every woman's journey is unique. Emotional healing and confidence. Birth is not only physical, it is emotional. You may feel joy, pride, relief, or even confusion. Everything you feel is valid. Give yourself permission to rest mentally, to ask for help, and to take things slowly. Your story is powerful, and your experience matters. Natural birth is a journey of strength, instinct, and trust. By understanding what happens step by step, you can walk into labor with greater confidence and calm. If this video helped you feel more prepared for your birth experience, make sure you subscribe to the channel, like the video, and share it with any mother who might need this information. Thank you for watching, and I wish you a safe, peaceful, and empowering birth experience.